A frightening statistic. More young teens here in Ohio die from suicide than anything else.
It is a sad truth that's only getting worse. But as Brad Underwood shows us, one expert says one of the best ways to reverse the trend is relatively easy.
5 people in Ohio die by suicide every day. And every 33 hours, one youth will commit suicide. These stats are the latest numbers from the Ohio Department of Health. Last year in Ohio, suicide was the leading cause of death in ages 10 to 14, and the second leading cause of death for people 15 to 34.
Statistics get our attention, and we just know that children are under a lot of stressors today.
Heather Smith is the executive director of the Southwest Ohio chapter of the National Alliance on Mental Illness, or NAMI. She says when it comes to children, social media and bullying can push young people over the edge if they feel they have no one to talk to.
Unfortunately, they think about how they can just end the pain they're feeling.
Looking back at 10 years of data, the state says suicide deaths increased by more than 500. That translates to a 45% surge. With the exception of 2009 and 2014, the numbers went up each year. In an effort to identify suicidal children or those struggling with mental illness, NAMI is now in schools with a program called Ending the Silence.
This is something for the middle and high school students in the classroom. And it teaches warning signs of mental health, it also teaches warning signs of suicide.
But also what to do when you see the signs. Smith says maybe the best way to help is to keep asking questions.
Notice things among our friends, notice things in our family, and ask the question, and then be quiet and listen.
Brad Underwood, Local 12 News.
And NAMI will be rolling out a program next year for businesses with how to spot signs of suicide and mental illness and how to respond.